Hi, my name is Pat Thompson. I'm public health nurse for Marshall County, and I'm glad to be here today. We're talking about COVID-19, the coronavirus that is spread all over the United States. How can you miss knowing about that? And today I'm going to talk to you about, what we're trying to do to keep people safe and how you can keep yourself safe, and talk about Facebook and some, anxieties that we have about this virus that's going around. And one thing I want to reassure you is that this too will end. As we know, anybody that's been around any length of time in the world knows that this too will end. We might look a little bit different, but it will end. So I want to tell you today I'm actually at the Iowa Valley Community College District office building. There's no one around, practicing our safe social distancing, 6 feet apart from anybody that's here, which is very minimal. So I want to say about social distancing, we actually are not supposed to have greater than 10 in a group of people, and that's really a lot. How do you keep 10 people 6 feet apart? Right, so we really need to pay attention to that. And if you're asked given the restriction to stay in your home for 14 days, that you respect that, and people do not come into your home either, And if someone actually does have the COVID-19 virus, then they also need to stay away from their family to keep the rest of the family as healthy as they can, or whoever's living in the home with you. And if that happens, we'll give you directions. So here's another thing. I talked to IDPH just yesterday, and we have some great epidemiologists there. And the idea is that you do stay home, and anybody that is ideally anybody that is a household member, household contact, that they stay home for 14 days also. Okay, we know there's maybe some different restrictions as far as some healthcare, some essential personnel in our community, and it's not just healthcare workers, it's also our police and fire that are kind of modified to a degree, but for us in the community, 14 days is the trick. Okay. As far as personal protective equipment, which would be like masks, gloves, that type of thing. The masks that we have that you see worn in hospitals and when you go into isolation rooms and that type of thing, or when they wear them in the operating rooms, that type of thing, are not made to contain viruses or protect you from viruses. So that's gives you a false sense of security that isn't there. Now that doesn't mean that if it's what you have always done, then I'm not going to ask you not to at all. Hope you have your supply. The supplies are, being actually diverted to places that really need them, like healthcare providers, healthcare hospitals, that type of thing, doctors' offices, clinics, that type of place where they need to take care of people, and that's part of how we take care of ourselves too. So I've had people ask about homemade masks, where the people are, and I'm not just saying ladies, men can sew them too, but they are pretty darn nice, but they won't have the protection from viruses because viruses are really teeny tiny and they can get through that. Gloves, really, to me, they're not necessary if you're washing your hands and using your hand sanitizer as you should. I've heard questions about money. Well, money's always been dirty. It's not changed. Flus here, flus and colds and that type of stuff are here. And actually, coronaviruses are part of the cold viruses that are out there, so the ones that aren't as dangerous, I guess is the right word, or that are not new, so we have some protection in our body. So anyway, gloves are something that need to be conserved also for where they really need to be used. So if you're out and about, wipe down we're very grateful for the wipes on the carts as far as I'm concerned. Will that end? They're all used? I don't know. But anyway, they help wipe down your cart. When you're done at the grocery store, wherever you're purchasing, wash your hands, that type of thing. Use a hand sanitizer, and the same for the people waiting on you. they're exposed to. But anyway, so gloves and masks aren't really necessary, but if that's your, I hate to tell someone who wears a mask because of lung ailments and chronic illnesses not to wear one, but it's not going to keep you away from a virus type of thing. And yes, and using hand sanitizer, even though we do know that washing your hands with soap and water is just as effective. You do that 20-second thing like we're supposed to. And we're trying to make sure that we practice what we preach. How's that sound? Hand sanitizer, it's great. We've really gotten the habit of using it. It's hanging on our purses, it's hanging on our bags. We have it hanging on the diaper bag, and that's good in instances where you can't get to soap and water. But we've kind of forgotten that actually you can use soap and water to wash and dry your hands, and that's very important. So use your 20-second time frame, whether it's seeing us on or counting it out, and then dry your hands thoroughly, because actually wet skin you can pick up germs easier because it sticks to the wet. And and I'm going to go to this, that when you turn off your faucets, use your elbow, use a paper towel, that type of thing, because if, like I tell people, that you touched it with a dirty hand to turn it on, if you turn it off after you wash it, you've contaminated yourself again. So, and I know that getting out of a bathroom that's a public bathroom is a trick. How's that sound? Use a paper towel to open the door, and then guess what? They got a blow dryer. So I understand all of that. We've all been there. Just do the best you can to keep from getting any viruses and bacteria on our hands, that type of thing. So we have bacteria on our hands all the time. It's part of our normal flora. So, anything that's on your hands and you touch your mouth, eyes, or nose, you're going to be exposing yourself to whatever on your hands. So just know that. Just dispose of your tissues so no one else has to. All those things that I'm preaching in the choir, but it's that you can also share this with other people too. And don't we always need a refresher? I know I do, and I appreciate it. So today, the coronavirus is, COVID-19 is the other name for it, is here. Iowa, and especially Marshall County, have avoided it for quite a while if you really think about it. And so we have some experiences from other parts of the country and other parts of the world of what they've done, and we're learning all the time. Not too long ago, Marshall County Public Health, along with the Iowa Department of Public Health, and Kim Elder with our Emergency Management System or agency, and all the many organizations in Marshall County came together, and we practiced actually getting supplies out to people if we would need to do that. Now we're not quite, well, we are actually starting to do some of that, but we're not quite at the point of mass giving vaccinations or giving medications like we did with H1N1, but we practice. We do this all the time, and we discuss it all the time. So be aware that planning is happening pretty much constantly, and that starts with our, actually the Iowa Department of Public Health has funding for that to happen, and that's what's important too, because nothing is free. And I want you to know too that fire department and our police department, sheriff's departments, businesses, schools are all part of this planning, and I failed to mention anybody, please forgive me, but healthcare centers, of course, healthcare caregivers are all part of this planning, and it's a very good thing. So, and actually our exercise was very successful, very good. And who knew we would have an opportunity to think we may have to use that sooner than we think. We'll find out. So anyway, I want you to know, as of this moment, I'm not aware of any confirmed cases in Marshall County, and I will know when there is one. And I'm saying when, because guess what? Coronavirus, COVID-19 is here in Marshall County. It's all over the United States. There's no place immune from it. That means community spread is happening where we don't know where it came from. In the beginning, we tested, or we made sure if someone had a COVID-19, I'll just try to say that, it's a little bit easier. If someone had that, we knew where they were exposed. Now it's community spread, and it can be anywhere. So I'm going to say this probably more than once, is if you're home and you're well and you don't want to get sick or get ill with it, the best thing you can do is stay home. Okay, that's the best thing you can do. That's why we have the social distancing. Stay home. It's not business as usual. We really shouldn't be going to the grocery store every day or more than once a day. Limit your time outside your home. That's easier said than done, I know, but we just need to be more deliberate in our actions that way. And we want, of course we want businesses to have business, and we understand going to Tyson's and Menards and all the other places in town that we can still go to. And we want to take care of them, but in order to stay the best health that you can, you need to stay home. That means that we can pay attention to our neighbors and, excuse me, we can pay, and it's not illegal yet to cough, so people do cough. So that's why you keep your distance, and people use good practice of coughing in their elbow or into a tissue and throwing it away and washing your hands afterwards, or use a alcohol-based hand cleanser. So people being home, we need to pay attention to our neighbors to see if they have any needs, so that people have more health issues aren't in the grocery stores and aren't needing to buy dog food and cat food and bird food and all those things that we do. So we need to ask if someone needs our help that way. And it can be done. So, and also I'm just going to jump here one moment. I want to say thank you to all our people that are working in our businesses that are out there for us, because, they are at risk doing that, and we appreciate the work that they are doing. So respect the 6 foot social distancing, even as checkouts and that type of thing, and know that without them there, we wouldn't be able to get the supplies that we really need. It's a novel virus, so we don't have protection in our bodies. Our bodies have to be exposed to it, then we go and get sick, and then we build up, send out little things that help us build up our immunity, and then the next time we're exposed, it says, wait, I remember you, type of thing. It's really what it is. It's a memory thing in our bodies to help protect us from getting as sick as we did last time. Now remember, like the flu keeps changing and mutating because it's a wily virus in my book, So you still follow the same, wash your hands, stay home if you're sick, cover your cough type of thing. But also we have to give a flu shot every year because it keeps changing on us. But people who have been exposed through the years and have their flu shots have more protection than people that don't, like our babies that are 6 months, less than 6 months old. Babies can't get any flu vaccine until they're 6 months old. So that's why we say stay away from little kiddos and people whose immune systems are not as robust, and even though mine's heading that direction, and maybe they're now, but as we age, our immune system isn't as robust. That's why we have to take care of ourselves, and like to deny it, but it's the truth. And just get your flu shots, get all the vaccines that are recommended for your age group, and that'll be a good thing for everybody. Because if you don't get sick, then you can't make other people sick, and that's a biggie. So testing, it's been in the news a lot where testing, and this is allergies, sorry, that testing is in the news, and the lack of tests, that's what we hear. And but we're at a point where if you have the symptoms of a virus, be it flu, cold, or the COVID-19, that you may or may not be tested, because for one thing, there's not enough not enough tests to go around for everybody. It's not even necessary, because if you have the virus, what would you do differently with a test? Okay, so we have to really think about people. They're automatically, I want to be tested, I want to know if I have it. Is that really necessary? Because what would you do differently? And that's real life in our every other day of the year world. How's that sound? And also, testing uses up personal protection supplies, equipment, PPE. It uses it up because they don't do testing just willy-nilly without being all prepared to be exposed. They want to prevent exposure, so testing is using up the PPE, personal protection equipment, and test kits when it is not always necessary. Now, we totally understand if someone is really ill, it is up to the healthcare provider who they test also. So it's not, if you want to test, you can always ask, but it's up to the healthcare provider to choose wisely who we test, and we appreciate that. And if someone does test positive for the COVID-19, I will get the call and I will be doing an investigation of that. So I will help whoever that person is with getting through the restrictions that need to have happen and help them to understand what they need to do, and I'll be monitoring them also. I don't go into the home. I won't be seeing them personally at any point, but I will be the one responsible for the investigation. So we talked about tests, we talked about, social isolation and or social distancing, and I can't say that enough, because actually I was in a webinar yesterday, and there's talks, do we close down the state, or everybody has to stay home, and that could make a difference. That could make a difference. Is it necessary? Not if people do their social distancing, and it'll be a decision that's made by our governor with the help of many talented people. As you know, we have not just one person makes these decisions. It's really with input from many talented people. And if that happens, that will change our lives too at that time a lot. So I think I would make sure you enjoy the freedom that we have right now. And I don't want to say you won't be free, but we're trying to take care of everybody. The ability to move around as we'd like right now with respect to taking care of ourselves and other people. I wanted to talk to you too about, we think, well, maybe we should all just get it all at once, and why are we doing this social distancing thing? And it's because we can't have everybody sick at one time. That's really what this is all about. So it prolongs the experience or response or whatever, our infection time, but we really need to not overwhelm our healthcare system any more than we have to. And so by not getting sick all at the same time, that really helps everybody. So I want you to understand that it's about having taking care of our people that are taking good care of us, that we respect that they need to. They don't have everything they need to take care of everybody at one time. Can you imagine that? So this is what we do, is how we stop some of that. And staying home too does make a difference as far as whether you get it or not. I keep saying that over and over again, but that's really the key right now. One thing you can do is actually be creative with your time when you're home alone or with your family. And I'm not a big Facebook person personally, but I know there's some entertainment on there. I want you to remember, though, when you're working with Facebook or using Facebook or any social media platform at all, that that is not your source of information on reliable information. I want you to use reliable sources, credible sources, such as the Iowa Department of Public Health or the Centers for Disease Control. When you go to IDPH, it's COVID-19. It's right there. You just click on it and it gives you all kinds of resources that you can use. Find your area that you're interested in, look at it, click there, and they'll give you some information. I do take phone calls. I can't take all calls all at once, but if someone does have a concern, they want to talk to me, I'll be glad to listen. Talking a little bit about, so Facebook, actually it's not your friend when you're trying to decide on whether you should be concerned or not, is what I really want to say, because there's lots of things that are untrue that look official and they're not. So please stay with the credible sources. That's just huge, because it's unbelievable how many people use that as their only source of information. I recommend that actually use more than one source. There's radio, TV, and I'll tell you, our people in Marshall County and in the state of Iowa are really working hard to give credible sources and give credible information. And sometimes, it may change on us because that's how it's going. It's changing a lot. It's even hard for me to keep up with individual areas that have concerns, but I do know my area. But so use credible sources, and I can't say that enough. And don't rely on Facebook as your only source. And if it's causing you anxiety and being overly concerned, then don't look. Seriously, don't look. I actually I'm rarely on, and if it doesn't make me feel better, then I just don't do it. Okay, because it's really about being very logical in what we're going through right now. I wanted to talk to you a little bit about cleaning. I hear deep cleaning, which is, it's a good time to spring clean if you're home, maybe. I don't know, but I wish I had time to do that myself. But, cleaning would be your normal cleaning products. Dispose of your trash the same way you normally would. Wash your hands always. You can't wash your hands too much, but be sure to use a lotion for skin protectant too, so don't hurt yourself with that. When you're using cleaning products, it's always important to read label directions, because if you only need a fourth of a cup, 1 cup is not better, okay? Good ventilation, good eye protection, good skin protection on your hands. So you read the label, use it as directed, because it's not necessary to do any more than that. I've had questions about carpeting, but that's not been something that I've seen that has to be any more than your vacuuming type of thing. It's carpets everywhere, and cloth is everywhere, or clothing's everywhere. So another thing too is that you can maintain your health, okay? I'm asked, how do you make yourself the best health you can be? And that's, getting enough rest, taking plenty of fluids. There's limits on our alcohol that we should be taking. Your healthy foods. Some people ask about a vitamin or anything like that, and that's up to you and your healthcare provider. The best way to get your minerals and vitamins is through healthy eating. So be sure you get your good nutrition that you need and get rest and plenty of fluids, and that would be the best way you can take care of yourself. And then also, being lonely is something. If you're home alone a lot, or actually hanging out with each other can be kind of a stressor too, right? We know that as real life it is. Find some things that lift those spirits and call a friend. You can certainly talk on the phone. You can use FaceTime. You can email. You can text as much as you can stand to do it. After a while, I'm kind of done with texting, because it's, let's just talk, type of thing. But anyways, things to help cheer yourself up, and making a phone call to a friend is so healthy for us too. Because, we've kind of gotten into, we think we want to be more isolated with this world of technology, and we're becoming that way more and more. Our younger people, it looks to me like they're used to it. I don't know if that's healthy or not, but and we know it's not really, we know that. But for us that have been used to being social and out there more and not relying on technology to find out who we are, whether people like us or not, is actually we would talk to people and be a part of social things. And we're asking you not to do that right now. Please, it will come back. I wonder how that will come back, whether it'll come back with, celebrations. We're looking even ahead at Easter, what's happening at my house. I'm not sure that I'll have Easter, even though we've made arrangements at my house. If this is going on, we won't be, because we want to take care of everybody. So those are things you need to think about, but also know that it can happen. I hear about graduations and weddings that are canceled, actually, and bridal showers I was supposed to go to, and things like that are canceled, but we can have one another time. I kind of tease that maybe at when the one person who's graduated from high school this year or college and heads off to their new life, you may have a graduation party the night before. We don't know that, but as long as I don't mess with my state fair, people that know me, we need these social things and things to look forward to. And it will be way different this summer. It will be different. I'm not sure what it'll look like, but it'll be different. In the beginning, this virus was supposed to be just affecting older people, because of chronic illnesses and a decreased immune system that's not as robust. But now, that it is affecting or not becoming. It's younger people, we're seeing that they're having, getting sicker than we thought. When H1N1 was here, we didn't worry about giving the H1N1 flu shot or the virus shot to my age group because we had been kind of exposed to all that stuff throughout the years. But we're seeing that even the younger people who have robust systems can get sick with it, But there's many, what they say, 80% of people that have this that get this virus, and we will, really have mild to moderate symptoms. They, stay home. I've got to actually say, do not go into any health clinic or any hospital or any urgent care or any place like that without calling first, because they want to be able to take care of you and protect everybody else in that area. So it's very important that you call before you go. Very important. But it's, it's kind of moving around a little bit. That doesn't mean children don't get it, but, so children may be having some chronic health issues too, or the age group that's changing. It looks like they're more in the 30s, that type of thing, that they're have some chronic health issues too that can be a part of that. So
no one's safe.
No one's safe. No one's safe. The degree of, it doesn't just hit older people at all. The degree of how sick you get or how it affects you, I think depends on many factors. Age, and any other chronic illnesses. So, like I said, you have some good habits as far as, washing your hands and eating well and getting your sleep and getting your fluids that you need. So if you need to get a hold of me or have some questions, my number is 641-844-2799, and that's my public health office. Again, 641-844-2799, and I'll do my best to answer your question. That's always a caveat with that I may have to look something up, or, I don't have all the answers, and as we know in this time what we're in, I can't change some things either. Don't hesitate to, use your credible sources. Like I say, please don't hesitate to do your distance of 6 feet between people. Wash your hands, cover your cough, stay home if you're sick. Those three things that when I say it, I see eyes glazing over, but it is what it is, and that's what we need to do. So public health is about protecting, preparing, and I can look at my name tag. Promoting health. So we're trying to do that all today. So thank you for listening, and until next time, bye-bye.